Thank you, Olivia. Good afternoon, everyone. Welcome to our February 24th COVID-19 briefing, and we're very pleased to be joined for this briefing by Dr. Levine, the Vermont Department of Health Commissioner, and Mayor Christine Lott from Winooski. The three of us wanted to speak to you together today because we have an important message to share with the Burlington and Winooski communities today. That message is this: it is very important that people continue to utilize the testing resources in our area. And these resources are free and easily available right now. We are seeing higher case growth in Chittenden County and specifically in Burlington and Winooski over recent days. We don't mean to be alarmist about this. There are some explanations for this, but the 7-day average of new cases is creeping back up. And today that 7-day average is at 35 cases. And Dr. Levine is going to speak to these trends a bit more. We are making good progress as a state, as a community, as a country in distributing the vaccine. But we know we still have months to go with that effort, and we need to make a final push to hold case growth down until that vaccine distribution effort is significantly further along. Testing for COVID-19 is an important part of how we do that. It always has been since we first talked on these briefings about a box-it-in strategy back in May and June as the state was reopening. Testing is one of the central strategies, and getting testing enables you and the teams that are working on containing the virus to know if you have the virus so that you can isolate and the state's contact tracing team can trace your contacts. And together, this is how we've had remarkable success at keeping the virus contained. The good news is the Vermont Department of Health and with the support of the city have worked together to create very strong testing infrastructure in our area. Right now, there's actually a lot of testing capacity that is not being fully used. This is a shift from earlier in the pandemic when we had times where we couldn't do as much testing as we wanted to. Right now, there are not quite 1,000 people scheduled for testing through March 7th. Sorry, right now through March 7th. So looking out over the next a little more than a week, there are currently not quite 1,000 people scheduled for a testing appointment, and there are over 6,000 open testing appointments available in Burlington and Winooski. There are interpretation services available at both of these community locations. And so today we really want to call on residents of Burlington and Winooski to consider getting tested for COVID-19, particularly if you have attended any small gatherings or traveled or have some other reason to think that perhaps you might have been exposed. I'm going to turn this over now to Dr. Levine to share more information about this. And I do just want to say we don't have the privilege of having Dr. Levine on these briefings very often, although the two of us do speak on a weekly basis, at least sometimes much more than a weekly basis. And it's been a real pleasure to work, Dr. Levine, with you through the pandemic. And I really appreciate you joining us today to share, to help us share this important message. Dr. Levine, I think you have to unmute yourself. I'm sorry.
I usually have to tell other people to do that. Thank you very much. It's always a pleasure. And I want people to keep a perspective in mind that Vermont, as well as the country, is really seeing marked improvement in COVID numbers since the middle part of January. And that was as true for Chittenden County as it was for anywhere else in Vermont. We had a significant decrease in the 7-day average of cases over that period of time. But during the month of February, these trends have changed. Olivia, am I going to be able to share my screen just to show 2 quick slides?
Yes, you can, Dr. Levine, or I also have those slides and could share them for you, whatever's easier for you. Yes, go for it. Great.
Did that just work?
Yes.
Awesome. So picture's always worth more than 1,000 words. You can see in the blue line, the rest of Vermont, and you can see in the gold, Chittenden County. You could see that there was a nice parallel course for a period of time in January. Chittenden got even lower than the average for Vermont, and now it's a little bit on the upswing. Now, again, as the mayor said, this is nothing that's alarmist. We actually clearly have, we could go way higher than this, but we're trying to catch this and nip it in the bud, if you will. I'll show one more slide. Here, which gives you a little sense for the fact that Burlington and Winooski, which is obviously who's on the call, that's why we're here, have been out of proportion in terms of 7-day average cases to the rest of the county. So that's all I'm going to do with slides at this point. The fact of the matter is, as I said, we've seen counties that I've been talking about at press conferences for a couple of weeks now have much steeper rate of growth. But obviously Chittenden County is our biggest county. It does account for a large number of the cases on a given day anyways. And we want to nip this kind of in the bud. The way you do that is through containment, which I've talked about frequently. And the way you do containment, which involves contact tracing, of course, and people isolating themselves when they're sick, is that you test. The only way you can do containment is to test. And that's really important. If we look at the number of tests that were done in Chittenden County in December, it was almost 12,000. If you look in January, it was almost 15,000. And you saw that our cases weren't very high at that time either. February, with only 4 more days to go in the month, has less than 9,000 tests completed. So markedly lower than before, to say the least. Now, my hope would be that's because so many of you feel well and aren't feeling ill and don't feel the need to get tested. But as the mayor implied, there are plenty of reasons to get tested besides not feeling well. And in fact, this virus is notorious for not causing symptoms in everybody that it infects and being able to be transmitted from one person to another, even if they don't know they have it. And that's why the testing is really a critical piece of this. So the reasons to get tested besides feeling ill or having your doctor request a test is that you have someone in your household who may actually test positive, or someone you've been in contact with that is a case, or that you've been in a gathering, or just socializing with people that you don't live with, regardless if you know their status or not. Because as you know, we're very concerned about multi-household get-togethers these days still. And clearly, if you're returning from out of state. So there's a lot of reasons to get tested. And I would include in that peace of mind, because there are a lot of times people just are concerned about some of the events or circumstances they've been in. So it's really the only way you'll ever know if you have the virus is to proceed on with the test. And as we've said, there's abundant ways to get tested. And we've done a great job of making access very easy. We've actually made the test very easy. At the predominant number of centers, you have a little swab that goes into the front of your nose, like a short Q-tip. And it's very user-friendly. I can say that having gone through it myself during the famous quarantine the governor and I had to have after one of our press conferences. It's a very easy procedure, and it's really not painful at all. You can get tested at Kinney Drugs. You can get tested at Walgreens. You can get tested at your healthcare provider frequently. You can go to a health department testing site. And in Burlington, you can go to 405 Pine Street. In Winooski, 32 Malletts Bay Avenue. We'd like you to have appointments, but generally walk-ins are welcomed at all of the sites. And you'll be able to actually use the same account if you go through a health department site to get tested and to get your future vaccine when and if that day comes for you, hopefully in the near future. So my conclusion is going to be that we are still on this dual pathway of getting more and more people vaccinated in the population so that they are really well protected against COVID-19, and having them and the rest of us continue to be as careful as we can through the spring for sure, but maybe not that much longer in terms of all of the usual advice we give about masking and avoiding crowded places and keeping your distance. So while we're on these pathways, I think it's important we notice what the slide showed, that the cases here in the county are on the uptick, especially in the Burlington and Winooski parts of the county. And just take note of that and try to do our best to try to really contain that as quickly as possible so that we can all benefit when we do get our vaccine dose. We'll be there at a time of very low prevalence of the virus in the community, and we won't have gotten sick before we got our chance to get the vaccine. So I'll stop there, Mayor.
Great. Thank you very much, Dr. Levine. Now let's go hear from Mayor Lott. Thank you again, Mayor Lott, for joining us. And what would you like Winooski residents to know about this testing opportunity?
Thank you, Mayor Weinberger and Dr. Levine for putting this together and helping continue to spread the word to our communities that this is an important piece of prevention. We have had significant outbreaks in our community in the past, and testing was a very effective strategy at finding those positive cases, finding people who needed to isolate, and really nipping those before they grew too large. We know from our last outbreak that the vast majority of folks that were positive did not have symptoms, did not know that they were ill. So testing is really important for that purpose. We also know that there are people in our community who can't practice the guidelines all the time, whether it's because of your living condition, because you have to carpool to get to work, because your workplace isn't great for social distancing, whatever the case is, you may be exposed on a regular basis without knowing it. So it's really important to keep getting tested so that you can find out if you have been exposed and if you need to isolate. We still have supports in place for folks who find themselves in that situation. You know, if you do test positive, a contact tracer will work with you. And as was shared already, this testing is free, low barrier. It's right at the community center here in Winooski. You can walk up. We have signs outside that say testing today. So please access this. You don't need insurance. You don't need to pay. You can just show up. You can also register online. Either way is fine, and make use of this wonderful service that we're happy that, you know, the state is able to help provide right in our community accessibly. Thank you.
Great. Thank you, Mayor Lott. Well said. So Olivia has just put up on the screen a list of the different locations and some additional information about how you sign up. I really, you know, I do think there were times earlier in the pandemic where we could only, there was too much demand for testing, and it was only available to certain people. And I do think there was almost a sense at times that, you know, you should be careful about how you were using this limited resource. We're now in a different place. To have 6,000 test slots available, but only 1,000 people signed up between now, you know, over the next couple of critical weeks, I think is an indication that to everyone. People should understand that this is a readily available resource. If there's any reason to think you might have been exposed, you're really very much invited to come and take advantage of this. I do just want to talk a little bit before we lose Dr. Levine. I just want to try to unpack a little bit these numbers, particularly in the Burlington area. You know, we have a number of members of the media here, and I just think it's important to kind of contextualize a little bit the numbers. And I'm watching a little bit on the Facebook stream. I see there's some comments about this, and so let's just kind of unpack this together. It is, as one of your graphs showed there, we have seen a change in the trend line, and there have been more Burlington positives in February than there were in January. It does look to me from the numbers like that is impacted by this issue that we've been talking about over the last couple of weeks. It's just that right around February 1st, the population that was here changed significantly. We had students come back and start to go to class, and that's a substantial increase in our population that happens when the students are here. So of the approximately 200 or so positives in the month of February in Burlington, I believe about 140 of them, or 2/3 of them, are attributable to the UVM community in one way or another. That I don't say that to in any way change our message about that, what's been happening at UVM, which is that we are aware that UVM is putting substantial resources into containing those, boxing in and contact tracing and isolating and making sure that those positives are contained, and that the overall positivity rate at UVM remains very low, and in fact kind of well below the broader community. And so this it's something that we are mindful of and watching and coordinating together on. I say that in this context because I think, there's always a question, what's going on when we see a change in the trend lines? And that's clearly part of the explanation of what's going on. So I think that all fits together. There is a lot of good work going on to contain the virus in this community. Burlington and Winooski and Chittenden County and the state of Vermont continue to be very vigilant. The people of these areas continue to be very vigilant and keep the case numbers low. And we know that the virus continues to be a threat. We know that there is some risk from new variants. And we really encourage anyone, given that in this period, to go and get tested if there's any reason to think they might have been exposed. Did I capture that right, Dr. Levine, from your perspective?
I think you did, Mayor. And I'll just, by way of further explanation, the Winooski graph pretty much parallels the Burlington graph almost precisely. And I'm not aware of that much in terms of off-campus living from UVM occurring in Winooski. So there are other explanations for what phenomenon we're seeing, for sure. But clearly the students do play a role in that. The nice part about that is I don't have to tell them to test more so we can work on containment, because they're on mandatory testing protocols. And on a given week, about 20 to 25% of all of the tests done in the state of Vermont are done on the UVM campus. So we're certainly doing exhaustive testing there, and that really helps the administrative staff isolate and quarantine students who need to have that done in the appropriate places and try to contain any kind of increase in virus prevalence on the campus. So our hope is to really emulate that in the communities as well, have the same rigor with testing and with containment. So thank you for allowing me to comment on that. I will say that we continue to send samples to the Massachusetts Public Health Lab to see if we can find the variant strain specifically in places with higher prevalence and with certain criteria. And the UVM campus is one of those places. Unfortunately, because of those weather events, the specimen delivery did not occur the way it should have this week. And so those results are still pending. But so far, we're still in the investigative stage of looking for the variants.
Well, I know you're going to need to sign off. I was just going to shift to update folks on the city's wastewater monitoring program and what it says about the variants. That this is sort of happening in parallel or coordination with the state's efforts to surveil for the variants. And here's the update there. And Dr. Levine, I'm not sure if you want to go now or if you want to see this part of the update as well. No big revelations here. As we shared in the briefing on Friday, the city's wastewater monitoring program is now seeing the mutations associated with the B117 variant in 2 of our 3 wastewater treatment plants. We initially saw it only in 1, and then the sample that came back last Friday detected mutations in both the main plant and the east plant. Not unexpected. The good news is that across much of the rest of the city, viral RNA prevalence continues to stay stable or trend down, and it's going to be something we're going to continue to monitor. So that's the update on the variants from the city's wastewater program.
No, thank you. And I appreciate very much the close coordination we've had with the city of Burlington and our insight into what's going on in the wastewater as sort of our glimpse into what might be happening on the ground, so to speak. Before I sign off, I would like to just express our appreciation from the Vermont Health Department to the many community partners in both Burlington and Winooski that we work with to really help educate everyone about testing, educate everyone about how to prevent themselves from getting virus, and all of the partners that have helped with many of our communities that don't have English as their first language, and really have been doing a lot of the heavy lifting, if I could call it that, that public health really needs and that we can't do ourselves. So organizations like AALV and the U.S. Committee on Refugees and Immigrants and the UVM LEND program very, very much appreciate all of their work, as well as the Multilingual Task Force. And I'd like to thank you and Mayor Lott, as well as community leaders that have really fostered the connections that we can make with all of these partners. So thank you all, and it's been great being with you.
Dr. Levine, thank you.
And to VD staff for being willing to connect with us, our staff, and with these community partners in better service of all of our residents.
I just want to echo what the 2 of you just said. The community partners have been critical here, and it's looking forward to continuing to work together in the remaining, hopefully, weeks and short number of months, let's hope, of this pandemic, to continue Vermont's really outstanding virus containment efforts. So thank you both for being on today. And I know Dr. Levine needs to go. Mayor Lott, you're welcome to either stay or if you need to go as well, understood. We have one other update we wanted to share now, which Rebecca Reese from the Community Economic Development Office is going to join me to help share. Rebecca, welcome. We are going to give an update on the city's early learning initiative, which does have a COVID-19 tie-in that we want to talk a little bit about today. Rebecca is here because she has been really a key point person within the city's early learning initiative. This is something, this initiative was something that after several years of study and effort, we launched 3 years ago to increase the availability and the affordability of childcare in Burlington. We did this because the research is really very clear that high quality childcare is crucial for the development of our youngest children and for working families. And it was also clear that that care was out of reach for too many Burlington children and families, and it was an area that really warranted more investment. The good news that we want to share today is that the Early Learning Initiative, in these initial years of its existence, appears to be making a dent in the problem. We are going to release a report tomorrow that is the 2020 annual report on the Early Learning Initiative. And the report finds that we have made progress in 3 critical ways. First, the ELI Capacity Grant Program, which is a grant program directly to childcare providers, has supported the creation of 92 new high-quality childcare spaces and helped stabilize 166 enrolled childcare spaces, and helped support the creation of 2 new high-quality childcare centers. All in all, this adds up to a 44% increase in high-quality infant and toddler childcare spaces that were and remain undersupplied in Burlington. A second area of progress is that the ELI First Steps Scholarship Program, which are scholarships to families with low incomes with very, very young children. This program has successfully funded 57 scholarships over the past 2 years and increased enrollment by nearly 50% in its second year. More than half of these scholarships support single parent households. So again, the first program is a grant program to the childcare centers that have helped them expand or stabilize. The second program, the scholarship program, goes directly to families that are scholarships for high quality childcare. And the third area of progress is that the scholarship program is designed to leverage state financial assistance to increase the total amount of funding for childcare in the Burlington market. And that appears to be working too. For every local dollar that we have been able to put in the pockets of Burlington households for high quality childcare, we have leveraged more than double that amount in additional state support. So I'm pleased that our Early Learning Initiative has been able to achieve this progress, and I'm excited for the city to continue to be part of addressing this critical challenge. This work would not have been possible without the important partnership of Let's Grow Kids and without Brian Lowe and Rebecca Reese, who run this initiative for the city. And so now I'm going to turn it over to Rebecca to share more information about this initiative and how it's changed in response to the pandemic and how families can apply, because that I believe we are we're coming up on another application period here. So Rebecca, take it away. Thanks for joining. It's great to see you.
Yeah, absolutely. Thank you for having me. I am always thrilled and excited and honored to come on and give updates. Our team has been working so hard again with Let's Grow Kids and Brian, and we are thrilled with the progress we've made in the last few years. So historically, typically, this is the time we are really hitting the ground running, starting to open up the application process again for the First Step Scholarship. That's where we focus our energy here at the end of winter and hopefully looking toward the start of spring in the coming weeks. This year is a little different. Like Mayor mentioned, we have taken the opportunity to really examine the program and make some adjustments in accordance with how the pandemic has affected our city. We've taken this stance and we've made what we are hope to prove to be a more inclusive program for Burlington residents. The first change is actually we've adjusted to rolling enrollment. So this year we aren't going to have just a single application period. We are accepting applications throughout the whole year. And this has made a huge impact for so many families. Just recently, we've been able to enroll 2 new families at the end of January. This is allowing us to meet families where they are right now, work on their timeline. They're able to get and access care when they need it, when they're getting back to work, and really when they feel comfortable putting their kids back into a group setting, especially in these uncertain times. Another change that I feel really strongly about, and I'm very pleased that we were able to make happen, is we've actually expanded the income eligibility requirements out to 80% of the area median income. Specifically, that's about just over $73,000 annual income for a family of 4. That number adjusts slightly depending on household size, and all that information can be found on our website if you're all looking for that. But I think this is just going to open up that many more doors. It includes all low-income Burlington families with young children at this point. It gets up to that low-income mark, and we can support more families. Again, like you said, Mayor, I think this is a good chance to remind everybody what is needed to apply and qualify for the program. You must be a Burlington resident. You do have to live in the city. You can access care either here in the city or even outside the city limits. You must meet those income requirements. Again, that 80% area median income at this point. And your child must be infant 2 to 3 years old seeking full-time childcare. And really, I have absolutely loved working on this project. It's a passion project of mine. I'm so grateful for the city looking for innovative solutions on this problem, for Let's Grow Kids leadership and their work to get us to where we work with us to get us where we are. And really, I think that this project can be an important step in our economic recovery. There are so many parents that list that they are looking for care to either stay in or re-enter the workforce. And I really think that this is just going to continue to grow and be an important partnership throughout the process.
Great, Rebecca. Wow. Well, your commitment to the program is really clear, and it's awesome. What you is really just you and Brian have been able to do with this still new program to expand it and formalize it. Those are great changes for the moment that we're in for the pandemic. I do just want to make sure, especially if there's any media follow up on this, that we're clear about eligibility. So I think I have this right, that the median income for a family of 4 is right around $70,000 a year. So the 80%. Okay, right. So the 80% of median, it's 80% of that.
No, I'm sorry, that is the mark. So it's 80% of the area median income. The area median income is a bit above that. So that actual mark to qualify for the program is $73,350 for an annual income for a family of 4.
Okay, all right. Thank you for clarifying that. And why don't we pause there? And I think Olivia, that's the full presentation for today. Are there questions from the public?
Great. And yes, there are a few questions for members of the media. And reminder, if you would like to ask a question, you can get in the question queue just by sending me an email. So the first question is from Kristen from NBC5. Kristen, you should be able to enable your microphone.
Hi, yes, can you hear me okay?
Yes, Kristen, go ahead.
Hi, so originally my question was for Dr. Levine, but then I realized he had to head out before the questions and answering. It was really about the talk about teachers and school workers getting moved up on the vaccination list, how moving them up would impact the current vaccine schedule, and how important it is to get teachers and others in the school system vaccinated.
So, Kristen, are you asking me about a change in?
I mean, it's so if you can't comment on that, or if that maybe is a question better for Dr. Levine, then that's fine. But that is something that I kind of did want to ask when it came to the COVID briefing today.
So, so your question, sorry, I just want to make sure your question is basically, shouldn't teachers be prioritized in some way?
Yeah, just about the prioritizing of teachers and where that might look right now on the vaccination list.
Yeah, I think that is really a question that Dr. Levine is really the person to speak to. It is the state that has been setting these prioritization lists. Their philosophy, their strategy has been to make the process as straightforward as possible and simple as possible, and to preserve life as much as possible. And they have really been deploying the vaccine on an age-based strategy. as a result of that. I am aware that there continue to be questions, and I'm sympathetic, frankly, to the people who say, look, our schools are really important. Shouldn't there be some kind of prioritization there? That, if we want to keep our schools open, isn't vaccination a strategy that needs to be considered? And, again, I understand that perspective. I think Dr. Levine is really the one who can best speak to why the state is coming down where they are. Although I think that my explanation I just gave you is a lot of why they are where they are.
Right. Okay. Thank you so much.
Okay. Thank you, Kristen. I appreciate you checking in.
And next in the queue is Grace from VT Digger. Grace, you should be able to enable your microphone.
Okay, great. I heard your explanation on why, you think cases are rising in Burlington and Winooski right now, but I also wanted to ask you why you think testing is so low. Why do you think residents aren't proactively going and getting more tests right now?
Grace, that's a great question. And I don't think we fully, I think it'd be somewhat speculative. Why? I mean, so let's see, having said that, am I going to speculate at all? I mean, clearly there was a period back really from the beginning of November through mid-January where we were seeing a concerning trend of increasing cases, and where also there were a lot of holidays in that period, which we know both played a role in fueling the growth, the gatherings that took place around holidays, and we also had very clear messaging and really urging by the governor and Dr. Levine and I and others to people to go and get tested if you had been at one of those gatherings. So I guess I think it does flow pretty directly if there is no longer the same level of concern about rising case numbers, and when there have been less of these gatherings, that some of the demand, some of the factors that were causing people to go and get tested have dropped off, and there's part of that is a good story. What I think this press conference is about, and the message that the three of us are trying to convey today is we have to stay vigilant. We should not let our guard down during these key remaining weeks of the pandemic. And I want to just remind people that the resource is there. I think the amount of testing that people were doing in part in those months was in response to public officials saying, go and get tested. And so we're saying that again. Anyone who thinks there's a reason they may have been exposed, they should go and get tested. You should have no concern that somehow you are taking the spot away from someone else who needs it more. There's ample capacity there. We urge people to use it.
Mm-hmm. And I'm also wondering if the city has any intentions to expand its current vaccination site, which I understand is the only vaccination site for the city as it currently stands. As more people are going to become eligible for the vaccination moving forward, does the city have intentions to expand to more sites or to more availability?
Grace, we're having a lot of conversations about that. I mean, I want to be clear, this is the city. This is not this, it is in Burlington, but it is a site that is run by the Department of Health. But we are in conversation with them. There is that site in Burlington at the Integrated Arts Academy is really only available on Wednesday because that's the day, that's kind of flex day when the schools are closed and the gym is available. And so we have had a kind of discussion with the state for weeks now about what's going to happen if the supply of the vaccine increases to the extent that we need to go to more than 1 day a week of vaccinations. And I know the state is looking at potential other locations within Burlington that they could add or move to, and that is an ongoing conversation. In addition, as we've talked a little bit about on past briefings, and I think we could talk about more on a future briefing, there has been some supplemental vaccination going on of limited English proficiency populations at other locations and at other times. So, as more of the, as we get further into this vaccination effort, other strategies are being used as well. And it's the effort isn't solely confined to this once a day IAA location. So I expect that to continue, and there to be additional supplemental opportunities in the weeks ahead.
So are you also saying that there's not enough supply in vaccinations right now to warrant more site locations?
Well, certainly the pace at which vaccinations are happening are driven by the supply right now. Distribution is not the limiting factor. If that's, and it has been moving upwards, as I know Digger and others have been reporting, and the hope is that with more vaccines being approved almost every week, it seems, good news about the Johnson & Johnson vaccine today, that there could be a very substantial increase in the supply. And there's no guarantee of this, but one of the hopes has been as the Biden administration gets established, as we get further into this, that the weekly supply will increase. I do think you could reach a point where you would max out that Burlington location, is what I'm saying. So we recognized that some time ago, so that's why there has been this ongoing discussion about, is another site needed?
And I just have one final question on the rising cases. If cases continue moving upward from transmission within college communities, at what point will city government intervene? I mean, how are you preparing to ensure that college students don't drive a considerable outbreak in Burlington?
So we we talked about this with UVM on the briefing several weeks ago. We said we'd be that the city was supportive. I thought UVM had earned the opportunity to attempt to make this work the way they did in the fall, which was exceptional, and that I think they have credibility that they can do this, having given the performance they pulled off in the fall, and but that we would be watching and in close conversation with them, and that's exactly what's happening here. And we are looking at the numbers. We're having frequent conversation with the teams that are working on this, and at this point, there, as as Dr. Levine referenced while he was on, there is a sense that UVM continues to have this under control. They are deploying massive testing resources to the containment. If we're looking to them to see that they continue it, and it's something we're watching very closely. There isn't like a magic number, a magic threshold. There are a number of factors that we're looking at. The availability of, we're looking at the numbers. How well is their contact tracing working? How successful are they at isolating close contacts? And there's, as we've stated before, there is both reason for concern and that there has been some increase in the case numbers, but also when you look at the full context, the numbers there remain quite low, and we continue to think they have the systems to handle this level of infections.
Gotcha. Thank you.
Thank you.
And that's all we have for questions. for today.
Great. Well, thank you, Olivia. Thank you again, Mayor Lott and Rebecca, for joining today. And that is going to do it for this week. We expect we'll likely be back next week, and we'll continue to be communicating about the pandemic and how it's unfolding here in Burlington. Thank you, everyone. Stay safe and take care.